Good morning, Dr. Alejandro Badia here for another bi-weekly episode of the podcast, Fixing Healthcare from the Trenches. And we definitely have somebody in the trenches. A lot of discussion in my book in chapter 3 during a surgical residency. And Dr. Assad Ali is a good friend. We met as when he was a medical student at Nova Southeastern School of Osteopathic Medicine. And he's now in a general surgery internship, probably wanting to pursue potentially spine, or you have a number of different interests. So we will see what you do. But the way we met is very, very important. And the reason I asked him to be on the show and give his perspective, he was a founder of a group called Entrepreneurs in Healthcare, which was a group of students at Nova who realized that you've got to have some business savvy, you've got to have an entrepreneurial spirit, otherwise the current healthcare system will really swallow you up. And it's obvious after all the years of education, now training that Dr. Ali's going through, that one deserves to do well and deserves to have independence in decision making. So welcome to the show, Assad.
Absolutely. Really happy to be here. I just quick shout out to Dr. Badia. He's been a really good mentor for me. I'm very lucky. And anyone who's watching this and is a medical student, I think it's very important to find a good mentor so that you can frame the next steps of your own career accordingly.
Well, and you had a leadership role as well because you were student government president. So, certainly we're expecting big things from you in the future, because we need colleague of mine said once that, we're the 10%, 90% of physicians are fortunately very good clinicians and very dedicated. But unfortunately, today's times require a bit more than that. And there is that sort of 10% of people who, take their head out of the sand and realize that we need some changes. So, what do you think some of those changes could be?
Yeah. You mentioned, obviously, I just started my training. So a lot of my kind of real patient interaction is limited, obviously, compared to someone like you who's had multiple years in such an illustrious career. For me, I think it starts with education, not necessarily for the resident or student right away, but also the patient. I think healthcare is a continuum, and there needs to be interaction with the healthcare system, and patients should really see that healthcare, and preventative healthcare specifically, is something that they should be thinking about daily. Healthcare isn't necessarily, oh, I'm sick, let me go to the doctor. It's every day, how can I improve my well-being or continue my well-being so I can avoid going to the doctor or avoid getting chronically ill. So I think
sort of the healthcare versus sick care concept, which a lot of people are bringing forward. We had Dr. Zeev Neuwirth. Shout out to him. He was on the show recently, and he's written 2 books about this. And yes, agree. What are you seeing as? I'm not sure if people understand what being an intern in general surgery is like. It's funny because I compared it to sort of the Navy SEALs training, and I remember one person got very upset about that, and ironically, I think it was a physician. So it kind of underscores my chapter 4, where we don't support each other enough. I got a very nasty review of my book for that comparison, but I think it's a very valid comparison, and I know things have changed a bit. It's a little more humane now than when I went through it at Bellevue Hospital and NYU, but it's still a challenge, isn't it?
Yeah, I think comparing the hierarchy of a surgical internship, nonetheless a whole residency, is quite accurate. I think within surgery specifically, and for me, learning how to work within the system is extremely crucial to your success. There's interns, there's mid-level residents, chief residents, fellows, attendings. And at the end of the day, no matter what you are as a resident, a physician, a non-physician, your ability to work within the system, soft skills with people, those are extremely important. So understanding the system you're in particular is extremely valuable to your success. So I would say that comparison is pretty accurate.
Well, and it continues, right? We all have to work within the system. I mean, I'm pretty fortunate. I'm in this cocoon here in Doral near Miami International Airport, and I haven't been to a hospital in about 12 years at all. But that's not the majority of physicians, right? And you do have to work within the system, and certainly internship and residency is great training for that. So let's get right to it. What would be let's just say your top 3 initiatives to really try to impact healthcare delivery in the U.S.?
I think going back to the theme of education as a whole, you have patients, providers, and then you kind of have this overview of the entire healthcare system. But starting with us as physicians and then medical students, you have to understand the system and the whole entire entity that healthcare is. And in medical education, at least in medical school, that explanation is lacking.
Right.
Especially when it comes to how does healthcare work behind the scenes. It's not just about learning about disease processes and curing them and medications and all these things. It's also a matter of, okay, how do these things actually get done? It's not just oh, I think this person has diabetes because their sugar is high, let's treat them. It's okay, we have to get them their insulin, we have to make sure they're eating the right diet, who's going to do all of that. And it's, again, a chronic thing. It's a long-term process.
That brings us to the what's the abbreviation SDOH, social determinants of health. We do not pay enough attention to contextual healthcare, meaning, as you said, that diabetic person, do they live alone? Do they live with people who have the basic education in terms of how to help them and to spot and to look for trouble? So absolutely, we have to look at a more global analysis of healthcare in order to save money. So that's number 1. What would be your second initiative?
I think preventative care is an emphasis that I think in the past decade or so has been growing, especially from, I'm going to call the patient the consumer of healthcare.
Yes.
I think there's been a lot more education, a lot more resources available to people to look at healthcare on this more of a continuum basis, because, if we're able to stave off chronic disease, and I'll just use the example of, osteoarthritis, something maybe a little bit more familiar for you,
Yeah, but I'm at the end of the food chain, and the problem is, yes, you need to be involved earlier.
Right. Yeah. And, doing things to kind of prevent that from getting to a problem where you're getting the knee replacement, when you're 60, 65, years old, and then there's complications. You gotta, and you gotta go to physical therapy. You gotta keep up with it, or then, otherwise you get problems with that, and then your bill goes up. And when your bill goes up, the entire bill goes up of healthcare. So, the education of preventative care and emphasis on preventative care within the patient population, I think. Yeah.
Number 3?
Number 3 is access. For me,
which is getting harder and harder. I was very public about opting out of Medicare after 28 years. I couldn't justify any more continued cuts every year in an inflationary environment, and my costs don't go up. And so that's going to affect access, isn't it? Because I'm not the only one. I mean, we tell the public gets a little bit incensed about this, but I ask people, and I'm very upfront with my patients and friends. I said, do you know a single profession where every single year on year, you're actually being asked to take a pay cut? I mean, is there a pay cut in almost any profession? It's really absurd. And the reality is that the society is lucky that there's people like yourself, right, out there, spending hours training. I mean, I think residency now, you guys kind of make enough to eat on now. I don't know what your salary is, but I remember my intern year was $25,000 in Manhattan, in Midtown Manhattan.
Possible. That's below the poverty line.
Yeah. So all these things are going to affect access.
Right.
That's a great. What else would you like to expand on in terms of that?
I think, kind of to sum up my overview of what we've been talking about, is that change begets change, and there needs to be a discussion with the powers that be in healthcare now, with folks in my generation of up and coming healthcare providers who do have a little bit more to say about how things are run, not necessarily what things are, being done in terms of acute care. I think once we're able to bring some of this change that's happening that we see on social media, that we're seeing in themes within the public, once we're able to make those actionable and put some guidelines in place for making healthcare a continuum, people preventing their chronic disease onset, or at least staving it off until later. These are things that I think are large principles, but should become foundational to, we could call it healthcare 2.0.
So you made a point about speaking to sort of the powers to be. I'm not sure how you phrased it, but it was there's a nebulous kind of overarching control. And again, I talk about this in the longest chapter in my book is chapter 9 on insurance. And the reality is that there's a purposeful veil with that industry, and with us, the people who are actually providing it. I mean, think about it. That has to change. That has to change. So I'm gonna pivot immediately to my 3. So one thing is, speaking of insurance, and we're seeing a groundswell now in this. I believe that we should have oversight, not authorization. Authorization is a hurdle every step of the way when you're trying to take care of a patient. Now, of course, there are people who are overutilizers, or people maybe who aren't doing the right thing. And so, we need to have oversight always. Second one is, and this is kind of my ortho now principle, right specialists at the right time. A lot of times our healthcare system forces people to go to their kind of overworked primary care doctor with, say, knee pain, right? Mm-hmm. I mean, I'm not sure a primary care physician is the best person to address. They can do that initial evaluation, but it should kind of end there, because if you get the specialist at the right time, that actually saves money. And the last one is in line with what you said, is public education. And that's why we're here. That's why we're on this podcast every 2 weeks. The big challenge for us is getting people to watch us. It's not as I jostle people, but it's not as entertaining as a cute video of a kitten. But guess what? this affects us. I mean, healthcare is something that we all eventually will need, our loved ones need, but it's also 20% of our economy. So, when are people going to really take interest in this? So I'm hoping that this and many other podcasts that are out there on healthcare, this one's supposed to be only about 15, 20 minutes. We know people are busy. Yeah. And the whole idea is to get these ideas out there, including your 3, which was education, prevention, and access. So I think those are terrific, Assad. And I'm going to give you any parting words.
Happy to be here. At the end of the day, I think, being in conversations with people like Dr. Badia and his colleagues who share similar mindsets is inspiring to us as budding professionals and providers. And hopefully folks who listen to this can spread this awareness and kind of inspire others to think a little bit outside of the box when it comes to healthcare.
Yeah, that's what we need. Well, I want to take a moment to just thank you for your service. I often say it to my patients who are first responders, but really people should be thanking, interns in particular. You guys don't sleep. It's unbelievable what you do. And, I remember those days. So thank you for that service, because you are the future, healthcare, provider in the future. So thank you very much. Until 2 weeks from now, thank you, everyone, from the trenches.